Hi, Mary.
Hi, how are you?
What's up? Oh my God, you're not going to believe this. I was just sitting here playing around on the internet while I was waiting for you guys. People actually swallow tapeworms just to lose weight. Look at this.
Look,
I don't believe this.
That's so gross.
I got to get more information on tapeworms. This is crazy.
Tapeworms. Common types. The beef tapeworm mostly infests cows and humans but can only reproduce asexually in human hosts. The pork tapeworm inhabits pigs and humans. Fish tapeworm affect humans, bears, dogs, cats, seals, and weasels. And the dwarf tapeworm, they live in the intestines of rats and humans. Life cycle and anatomy. The adult tapeworm lives in the small intestine. An infected person usually has only one or two worms. The tapeworm use their scolex to attach themselves to the intestinal wall. They have many body segments called proglottids, each containing many eggs. The eggs can survive for months or years in the environment. When cattle or pig eat contaminated vegetation, the eggs hatch and burrow through their intestinal wall. The larvae burrow into muscles and form fluid-filled cysts. If humans eat raw or undercooked beef or pork containing cysts, the cysts develop over a 2-month period into adult tapeworms. Prevalence. In North America, the beef tapeworm is most common, although it is relatively well controlled. In Latin America, the pork tapeworm infects millions. The fish tapeworm and pork tapeworm are both common in Asia. Symptoms: nausea, weakness, loss of appetite, abdominal pain, diarrhea, weight loss, fever, cystic masses or lumps, allergic reactions to the larva, bacterial infections, neurological symptoms, including but not limited to seizures. Causes of infestation. If a person ingests microscopic tapeworm eggs, the eggs develop into larvae. Mobile larvae migrate out of the intestines. They form cysts in other tissues, such as lungs, central nervous system, or liver. The ingestion of larval cysts develop into adult tapeworms, which attach themselves to the walls of the intestines. Risk factors: poor hygiene, such as infrequent washing and bathing. Exposure to livestock is especially problematic in areas where human and animal feces are not disposed of properly. Traveling to developing countries can increase the chances of infection in areas with poor sanitation practices. Eating raw or undercooked meats. Improper cooking may fail to kill tapeworm eggs and larvae. Living in endemic areas. In certain parts of the world, exposure to tapeworm eggs is most likely. Complications. Digestive blockage. If tapeworms go large enough, they can block your appendix, your bile duct, or your pancreatic duct. Organ function disruption. When larvae migrate to the liver, lungs, or other organs, they become cysts. Over time, these cysts grow, sometimes large enough to crowd the functioning parts of the organ or reduce its blood supply. Brain and central nervous system impairment, called neurocysticercosis, can result in headaches, visual impairment, seizures, meningitis, hydrocephalus, or dementia. Death can occur in severe cases of infection. Tests and diagnosis. Stool sample analysis. A laboratory uses microscopic identification techniques to check for eggs or tapeworm segments in the feces. Blood test. The body may have produced antibodies to fight tapeworm infection. The presence of these antibodies indicates tapeworm infestation. Imaging exam. Certain types of imaging, such as CT or MRI scans, X-rays, or ultrasounds of cysts, may suggest invasive tapeworm infection. Treatments. Some oral medications are toxic to adult tapeworm and can shrink some tapeworm cysts. Shunt replacement is placing a permanent shunt or tube in the head to help to drain the fluid. Cysts can also be removed surgically. Prevention. Wash hands thoroughly. Wash and cook all fruits and vegetables with safe water, and dispose of livestock waste properly. Thoroughly cook all meat. Freeze meat for at least 12 hours. Avoid eating raw or undercooked meat. Promptly treat tapeworm in pets or livestock.